This is James with Net News Ledger. It's April the 22nd, 2020, and here is what you need to know tonight. In our top coverage, we're going to be covering the COVID numbers. The Thunder Bay District Health Unit is reporting new cases. The Ontario Provincial Police continue their search for a missing woman in Nipigon, and Thunder Bay District and Mental Health and Addictions have put some new features together to help people. And we'll close off our news tonight with an interview with Minister of Health and Thunder Bay Superior North Member of Parliament. Tonight, leading off the news, our COVID report. COVID-19, there are 2.6 million cases worldwide. 183,160 people have died so far. Here in Canada, there are 39,813 confirmed cases of COVID-19 with 1,966 deaths. The issue is starting to flatten for the curve in Canada. We have more with our coverage later tonight with Hajdu, the Minister of Health. The Thunder Bay District Health Unit has declared 4 new cases, bringing the total number of cases in the Thunder Bay District to 55. 3 of the new cases in the district are for First Nation communities, and they're from close contact. They're not telling us which community, but I'm sure if you watch social media, there'll be a lot of discussion. Over the last couple of days, there has been some concern about an increased presence of Ontario Provincial Police in Nipigon. The OPP are continuing their search for a missing woman who's in the area. She was from Gillies Township, and she's been last seen last weekend. OPP have got the Underwater Search Division. They've got everything they can to try and help find this woman and hopefully to bring her home safely. We've also got coverage tonight on the Thunder Bay and District Mental Health and Addictions, who have increased their ability for people to get treatment. What's starting to happen here is we're getting people in the community starting to take the issue of mental health and addictions during COVID-19 more seriously. And here's our interview with Minister Hajdu. Joining us by phone from her Ottawa office is Minister Patty Hajdu, the Member of Parliament for Thunder Bay Superior North and the Minister of Health. Minister Hajdu, good morning, and once again, thanks for taking the time.
Thank you very much for having me.
This is going into weeks and weeks, and what do our readers and viewers need to know?
Well, first of all, a big thank you from me as the Health Minister for all the hard work, courage, and self-sacrifice that Canadians are showing, and in Thunder Bay Superior North residents are showing. It's really hard, and I think what people need to know is that their efforts are paying off. We are starting to see a slowing down of new cases. The doubling rate of cases is now every 10 days roughly instead of every 3 days, which is a good sign because it means that less people are getting infected, and that just simply means that people are staying home and they're really watching their close contact with other people. So that's the good news. I think the less positive news is that we still have a ways to go. We are looking now at measures that need to be in place, a health safety net, if you will, for the country as we start to think about coming out of this stage of essentially a halting of economic activity. But we know that it has to be done carefully, and we know that if we don't do this carefully together and we don't have the appropriate measures in place and that we don't see a true decline in new cases over the next couple of weeks, that we might be in for a bit longer measures.
We're starting to get some fairly long-ranged cancellations. The CLE closed the car show for April. Live from the Rock was canceled yesterday. The Buskers Festival at the end of July has been canceled. How long do you think this is going to take?
Well, I mean, I think it's going to happen in stages, my gut tells me, because I think about, if we don't have a treatment for severe cases of COVID or a vaccine to prevent the widespread infection of COVID-19, it's going to really change people's behaviors, and people are not going to want to congregate in closed spaces or, are not going to want to be at big crowds of, in events where there's big crowds. So I think, when you think about events that might bring a lot of people together in close spaces like that, and a lot of touching of surfaces such as car shows or the like, I think you can rightly understand why the organizers are worried about whether or not their event is going to be something that's safe to hold. And I think the second question is whether people will want to attend those events while we still are in a period of uncertainty about this disease.
The Government of Canada is bringing in a lot of measures to help people. What can you share with us?
Well, first of all, I want to thank the civil servants who've been working night and day to launch new measures in historic speeds that are really about alleviating the financial suffering of Canadians and trying to make sure that everyone has something. And so we've got, for example, the CERB, which has been rolling out money to Canadians who've lost their jobs or are laid off or caring for someone who is sick, etc., or people that are stuck at home with children, for example, that normally would be in school. These are measures to help alleviate some of that financial pain. We've got a wage subsidy for employers. There's a calculator online now, by the way, for employers so that they can go in and figure out what they're eligible for and for what period of time. And we've got a number of other measures to support students, for example, the alleviation of loans and expansion of Canada Summer Jobs. These are all things that we're trying to do to make sure that no matter who it is, there's some measure of financial safety during these very difficult economic times as well.
Probably not quite what you thought you'd be doing in 2020 as the health minister and MP for Thunder Bay Superior North.
No, actually, I was thinking back to the election and how we were campaigning on a platform that was actually, there was a lot of healthcare actually in that platform, if you recall, pharmacare and access to primary care and all of those kinds of things. But and so when I was appointed health minister, I was very excited to work on those things, and I still am excited, I have to tell you. I think that the silver lining to COVID is it's really drawn an attention to the cracks in our public healthcare system, in our national healthcare coverage, in the way that that healthcare is able to provide for people in various different parts of the country in different kinds of intensity. And so I think this is an opportunity, in a way, if there is any silver lining to this, to take a look at our systems of health and think about how we bolster them so that we have a very strong health safety net in the next steps of COVID-19.
Minister Hajdu, again, thank you very much for taking the time.
Thank you very much for the interview, James. Have a good day.
You too.
Okay, bye-bye.
Hit that subscribe button, hit that like button, share this video, and keep up to date on what's going on.